Back to developments on swine flu today. At the top of the hour, we told you about another Michigan death, a Roscommon County man dying of the H1N1 virus. That, as the World Health Organization increases its alert scale to its highest level, pandemic, meaning the disease is spreading all around the globe. Right now, nearly 28,000 people in 74 countries have contracted the disease. 141 have died. I'm joined right here in studio now by Dr. David Baumgartner, infectious diseases specialist with St. Mary's in Grand Rapids. Thank you for joining us.
Good evening.
Well, pandemic level, what does that mean, and why has it taken so long to finally say it's at a pandemic level?
Yeah, so they're now declaring level 6, which is the highest level. What that really means is that there's human-to-human spread that's occurring in widely separated areas. For practical purposes, it's occurring on more than one continent and among multiple countries. And what they've found now is there's tens of thousands of cases, and as of today, 74 countries around the world, in North America, South America, Europe, Asia, Australia, really widespread influenza activity.
Of course, we had another person die in Michigan. The severity of this illness, though, is it's widespread, but it's not as bad as what it could be, I guess.
Right. So it's being characterized as moderate influenza. And at St. Mary's in the infectious disease department, we've really been following this closely. We find that moderate disease means that the mortality rate's really pretty small, maybe 1 or 2% of all people who get infected. But if you think about the tens and probably hundreds of thousands of people who've been infected, it does have a serious effect. We also know that compared to regular flu, seems to be worse when pregnant women get it, and it seems to be worse in younger people. So it's a little bit different than the typical pattern we see with influenza.
Being seen in 74 different countries, you were saying, how is this being handled around the globe to keep it contained?
Well, it gets back to the standard kinds of infection control messages that we've been giving out all along. Washing your hands, covering your mouth when you're coughing and sneezing. If you're sick, stay home from work. Really kind of the standard things. The other thing that's being worked on is trying to get a vaccine for this. And within the last 2 weeks now, the vaccine manufacturers have received seed vaccine and are trying to put this into production. So it remains to be seen whether we're going to have enough commercially produced vaccine to protect us from this when we get back to the real bad flu season in the fall and winter in West Michigan next year.
So working on it.
Yes.
See how fast they can get that rolling.
Yes.
Okay. Dr. Baumgartner, thank you so much for joining us from St. Mary's. We appreciate it.
Okay. Thank you.